Have you ever looked at your kitchen cabinet or bathroom shelf and thought, that's just my usual stuff, nothing special? A few multivitamins, a fish oil capsule, maybe some baby aspirin you've been taking for your heart for years. Nothing unusual, right? Now picture this. You're 78. You scheduled a routine knee replacement, something you put off for far too long. The doctor said it would improve your mobility. You've got the date. You've arranged the ride. The pre-op paperwork is all set. Then something strange happens. Just a few hours after the surgery, your blood pressure drops. Your wound keeps bleeding longer than expected. You feel dizzy. You're rushed back under observation, and the surgeon looks puzzled. And then someone finally asks, "Are you taking anything else? Supplements? Over-the-counter meds? Anything you didn't mention?" That's when it clicks. You tell them you've been taking turmeric every day for joint pain. You thought it was harmless, natural, but no one told you it could thin your blood. And now you're bleeding more than you should, recovering slower than expected, and facing risks that might have been completely avoidable. This is not just one story. It's a hidden reality thousands of older adults face each year. And that's why this video could make a real difference. Today, we're going to talk about the medications and supplements that seniors commonly take, the ones that seem so ordinary, so familiar, and why they can quietly interfere with surgery or recovery. You'll learn the real risks, not to scare you, but to empower you. Because a little awareness, shared at the right time, can change everything. Let's dive in. 1. The medications that seem harmless, but aren't. Let's start with the most common one, aspirin. If you're over 65, there is a good chance someone once told you to take a low-dose aspirin to help prevent heart attacks. For decades, that was the standard advice. But in recent years, the guidelines have changed, especially for seniors. Why? Because while aspirin may help reduce clot-related heart risks in some people, it also increases the risk of bleeding, especially during or after surgery. It's not just prescription blood thinners like warfarin or clopidogrel. Even over-the-counter medications like ibuprofen and naproxen can increase bleeding risk if not stopped before an operation. So many seniors walk into surgery thinking, well, it's just Tylenol, or it's just a baby aspirin, but it's not. The body of a 75-year-old doesn't react like a 35-year-old's. Your liver and kidneys process drugs more slowly. Your blood vessels are more fragile. Your body's ability to stop bleeding or to heal can be deeply affected by even harmless medications. And yet, many people never think to mention them. 2. The natural supplements that can cause unnatural problems. You heard it before. It's natural, so it's safe. Unfortunately, that's one of the most misleading ideas out there. Natural doesn't mean harmless, especially not when it comes to surgery. Let us talk about some of the most common supplements older adults take and how they can quietly complicate your recovery. Turmeric, popular for joint pain and inflammation, contains curcumin, which can thin the blood. Garlic, taken for blood pressure or heart health, also has natural blood-thinning properties. Ginkgo biloba, often used for memory, can increase bleeding risk. Ginseng, used for energy and immune support, can interfere with blood clotting and blood sugar control. St. John's wort, popular for mood support, but it can interact with anesthesia and reduce the effectiveness of pain medications. Fish oil, a common daily supplement. It's good for the heart, but in high doses, it also thins the blood. And here's the kicker. Most doctors don't ask about these because they assume you'll mention them. But most patients think, oh, it's just a vitamin, and never bring it up. 3. The real story of Frank, age 81. Let me tell you about Frank. Frank was 81, sharp as a tack, and as careful as they come. He was scheduled for a minor outpatient procedure, just a cyst removal. He brought in his list of medications, heart pills, cholesterol meds, and even a multivitamin. But he didn't mention the turmeric capsules he'd been taking for his arthritis. Surgery went fine. But within hours, the bleeding wouldn't stop. The wound that was supposed to stay closed kept oozing. The team was baffled. Until a nurse asked casually, "You're not taking anything else, are you?" Frank blinked. "Oh, just turmeric. For the joints. You know, natural stuff." That was it. That little yellow pill. The one he thought was safe. The doctors had to re-stitch the wound. Frank stayed overnight just to be safe. But the delay, the stress, it all could have been avoided with one simple conversation. 4. The importance of a full medication list and how to do it right. If there's one thing every senior should do before surgery, it's this. Make a complete list of everything you take. Not just prescriptions. Not just the medications your doctor gave you. But everything. Over-the-counter pain meds, herbal supplements, teas and tinctures, eye drops, creams, patches, vitamins, powders, essential oils, anything you use on a regular basis. Now here's the key. Don't wait for your surgeon or nurse to ask. Tell them. Say, "Here's everything I take daily. What should I stop before surgery?" Because in many cases, they won't know unless you tell them. And in some cases, you may need to stop certain supplements 7 to 14 days before surgery to avoid complications. This one step, this one proactive list, could be the reason your recovery goes smoothly instead of becoming a nightmare. 5. Why this matters more after 70. As we age, everything changes. The way our body metabolizes medication. The way we respond to anesthesia. The way our blood clots. The way our immune system heals. What might be minor in your 40s can become major after 70. A small delay in healing can become an infection. A little extra bleeding can lead to transfusion. A supplement that once felt like nothing can suddenly throw off your entire system. And here's the truth no one talks about. Doctors aren't always trained to ask about supplements. And many supplements aren't regulated, so their interactions are underreported. That's why you have to be the advocate. You have to speak up. You have to make sure nothing gets overlooked. Because no one knows your body better than you, and no one else can protect it quite like you can. 6. The post-surgery phase. What to watch for. Let's say you've had your surgery. You stocked your supplements in time. Everything went well. Now what? Now, your body is focused on healing. And this is where you have to be just as careful. Some people rush back to their old routine, popping fish oil and ginkgo the day after surgery. But wait, ask first. Some supplements can interfere with your post-operative medications, your immune response, or your inflammation levels, all of which are critical in the healing phase. Ask your surgeon or pharmacist, when can I safely resume my usual supplements? Is there anything I should avoid until I'm fully recovered? This is especially true if you're on pain meds, antibiotics, or blood thinners after surgery. 7. Stories that save lives, including yours. There's an old saying among nurses. It's not what we know that gets people. It's what they forget to mention. Don't let that be you. Let your story be different. Let it be a story of awareness, of taking charge, of healing the right way. Because these aren't just pills and powders. They read pieces of a puzzle that affect your entire system, especially when your body is under stress. And finally, a reminder for the people you love. If you're watching this video and thinking, this doesn't apply to me, I'm healthy, I'm careful. That's great. But please think of someone else who might need this. A spouse, a friend, a neighbor with an upcoming surgery. Sometimes the greatest act of wisdom is sharing what you've learned. So forward this. Talk about it. Ask someone you love. Do your doctors know everything you're taking? You might just change a life. Thank you for watching. Your health and your healing matter more than you know. And sometimes the smallest actions, a list, a question, a conversation, make all the difference. Stay safe, stay informed, and stay well.